Good afternoon. Welcome to today's webinar focused on gerontological nursing. I'm Jen Scherzey and want to welcome our author and presenter today, Kristen Mauk. So at this time, I'd like to turn the presentation over to Chris. Go ahead.
Well, hi everyone. I am so excited that you have joined us, and I'm really excited about this 4th edition of our gerontological nursing book. And so I wanted to let you know a little bit about my background, and then I'm going to talk about some highlights, like why do we even care about having gerontological nursing in our curricula. And so I'll talk about some of the highlights from the profiles of older Americans from 2015, and then we'll talk about the book a little bit. So as far as my background, I am one of those people who went to school a lot. And my background is as a Gero CNS. That's where I started, and then I went into academe. So I have my PhD, and then later on in my career, I went back for my doctorate of nursing practice and my gerontological nurse practitioner. So you can see those credentials there and where I went to school. I'm also certified as a rehab nurse and an advanced hospice and palliative care nurse. So my whole world has kind of been chronic illness and care of older adults, and especially from the framework of rehabilitating older adults who have chronic problems. So that's kind of my world view where I come from. So if we look at the background of our text, it is based, I think, very uniquely on the AACN Hartford Competencies, and I've noticed that some other texts have started to weave these competencies into their books, but we were the first, I think, to do this, and we actually use those competencies as a framework for the book. So the book is structured around the competencies, which is one of the highlights, I think, of the book and what instructors and students tell us they really like about it. So our aim is to prepare students to provide excellent care to older adults. And let me just give you some of these highlights from 2015 from this profile of older Americans from the Agency on Aging. So we all know that this is becoming a huge population. There were 64.8 million people in the United States over the age of 60 in 2014. And that means that 1 person in every 7, or about 15% of the population, is an older person, and we know those numbers are increasing. And in fact, there were over 72,000 people who were over the age of 100 in 2014. And I have one of those ladies in my church, and she is 104, and she has complete cognition, and she comes to church every Sunday. She walks in with her walker, and she's just a delightful person. But we're going to see more and more people living to be that age. However, about half of older women, like 46% who are over the age of 75, live alone. So we as educators know that that has great implications for what we should be teaching our students. And another statistic that I always thought was so interesting, and I'm finding myself in this situation myself, is that in 2014 there were over 500,000 grandparents who were age 65 or older, and they had primary responsibility for their grandchildren who lived with them. Now, I'm not over 65 yet, but I am having full-time care of one of my grandchildren who lives with me. So all of these things are very personal to me that are in the book, and what I've really tried to do in writing this text and editing it and recruiting the authors that I did for all the chapters was to make this really meaningful and practical for people caring for older adults. And because I have done this my entire nursing career, I'm very dedicated to excellent quality care of older adults. So what this text does is combine gerontology issues with gero nursing. And when we looked at other books, probably 10 years ago when we first did our first edition of this, we didn't see real good frameworks for books, and that's why we decided to use the Hartford Competencies. So let me talk a little bit about why our book is unique. We have 50 authors in this edition, and that's actually less than some of the prior editions, but they are from all different walks of life, if you will. So we have someone who's a PharmD, we have a forensic nurse, we have family nurse practitioners, we have academes with PhDs, we have DNPs, we have Gero nurse practitioners, Gero CNSs, people with education doctorates. We have people that are biologists, gerontologists, legal nurse consultants, wound nurses, social workers, psychologists, people who do data coding, and all of those are authors in our book. So I think it gives it such a rich interdisciplinary, interprofessional flavor. And a lot of these chapters were co-authored between a different team member and a nurse. So we have people who are clinicians, who are fellows in many different organizations. Some are teachers, some are Gero researchers, and they're from all over the United States. So we also have a couple authors from Canada. So I feel like we have really good representation from everywhere. And we're focusing on the most essential information, but in a comprehensive way. And I want to talk also about our reviewers. We have 15 reviewers, and it was very important to me to have reviewers for the text to make sure that we were getting the best evidence-based, research-based information for our students to be put in this textbook. So I had previously felt that a lot of our competitors' books were like too medical surgical repetitive, so they were like med-surg books with like a little Gero thrown in there. I feel like our book focuses on care of the older adult. And our 15 reviewers are from all different states. We have people from Pennsylvania, North Carolina, Arizona, Oklahoma, New Jersey, Alabama, California, New York, Vermont, Texas, so all over the U.S. So we have good geographic representation of our authors and our reviewers. And our reviewers are, some are family nurse practitioners, some have PhDs, DNPs. We have adult Gero NPs, Gero NPs, we have clinical nurse leaders, woundostomy nurses, and certified nurse educators. So all our reviewers also have a really great range of experience and location. So some of the benefits to our students. I really feel I have used this book for many years, well, since it came out, of course, in my own teaching. So I feel like that every time we do a new edition, I use that feedback from my own students to make the book better. So I'm really, really happy about this 4th edition. I feel like it's very student-friendly. And I'm so happy that Jones and Bartlett lets me have a say in the cover because they gave me choices, and I said, the cover of a book is really important to me, and maybe it's just my own thing that I like about that, because I think even though we're going to more digital text, some students still like to carry books. They like to have a book on their shelf. They like to pull a book to reference. And I think the cover is really important, and it was important to me in all of the editions to actually have people on the cover, not artwork. So I wanted it to portray active aging. And now that I live in Colorado for the last couple years, I was so happy they found like older people hiking, because where I live, all the older people are very active. They climb mountains, they do snowmobiling, they ski. In fact, I live near Telluride, which is a pretty famous small ski resort, and it's very hard to get to, but they even offer a discount. Well, if you're over 90, you get to ski free. So that should tell you a little bit where I live, that they can offer a discount for people who are still skiing when they're over the age of 90, which I think is so awesome. So I really wanted this text, this edition, to be user-friendly to students, to be visually appealing, and I think the colors that Jones and Bartlett has chosen for each of the editions, I especially like this one, are very, they kind of jump off the page. They're very soothing. A lot of the resources that they have are interactive, and I think that we have logically arranged the text so that students, when they see this book, are like, oh yeah, I'll open this book, instead of it, you know, maybe being a turnoff to them. So let's talk a little bit more about what is inside the text. I'll just kind of talk about what is under each of these units. So in Unit 1, this is just the foundations of gero nursing. So there's an introduction written by Jean St. Pierre and Deborah Conley, and it's really a great history of gerontological nursing. It also talks about advanced practice roles, what the newest certifications are, because we know those have changed recently. And the second chapter is about the aging population, and that has a new author, but there's a lot of tables and graphs and statistics and history of aging in the U.S. There's some content that we added on genetics and genomics, and so just kind of an overview of the aging population. Then Chapter 3, still within Unit 1, are the theories of aging, and pretty much those have stayed the same since the last edition, but I really think it's important to know what these theories are. We draw from all the different social sciences, biology, and things like that to talk about, explain why we age. So I think that's a good thing for students to know. And then Chapter 4 was an E-chapter because it's rather long, but it is one of the best chapters I've ever seen that reviews the aging of physiological systems. And it was written mainly by, not by nurses, but by biologists. So it's really, I think, a rather advanced chapter, and I know that I have used this for nurses in graduate programs because it's very detailed about how our systems age physiologically. And then when we move to Unit 2, that is still on communication and assessment. And there is a new updated chapter on teaching and communication with older adults and their families. And this is authored by Dennis Andrejka, and Dennis is an expert teacher. He also has his own book on affective teaching. So some great content in there about teaching older adults and communicating with them. And then Chapter 6, also under Unit 2, is on comprehensive assessment of the older adult. Then when we move to Unit 3, this is health promotion, risk reduction, and disease prevention. And there's a lovely chapter by David Haber, who also has his own book on healthy aging, on promoting healthy aging, independence, quality of life. So wonderful content on that, and David Haber's a gerontologist. And then Chapter 8 is identifying and preventing common risk factors. Then when we move on to Unit 4, we're talking about illness and disease management, and we're reviewing, Chapter 9 is rather long, and I brought in another author who's also a nurse practitioner, and she and I revamped that chapter a little bit and condensed some of the information. But if you were to use this book and you were using it, say, in a standalone gerontology class or threading it through your program, it reviews kind of the things we would call med-surg, like what are the background and significance of these diseases? What are risk factors and warning signs? How do we assess? How do we diagnose? What lab tests will we use? And what are the common interventions and strategies for care? So we look at like the major disorders that we see among older people. So even if your students didn't have access to a med-surg book, you know, they could always go to a med-surg book to look for more detail on like cancer care or things like that. But you're going to have enough content in that Chapter 9 to give them a good review. And then in Chapter 10, we have a whole chapter that is nursing management of dementia with lots of practical boxes for students on how to handle certain behaviors, which is really helpful. Then in Unit 5 is management of geriatric syndromes, and we added this in the last edition. And this is because these are some of the things we see so often in gero care, but they're not necessarily discrete diseases. So we have a chapter on polypharmacy that's written with a nurse and a PharmD who specializes in gero, and a lot of great information with the Beers list and rules of prescribing and things like that. Then Chapter 12 is on falls, and that's authored by Deanne Zwicker, who is also an author on the evidence-based protocols, along with a couple well-known people from the Hartford Foundation. So she came and did the falls chapter for us. And Chapter 13 is on delirium by Susan Rose. And Chapter 14 is depression and anxiety. So we know that we see those a lot together. There's also a chapter on urinary incontinence, a separate chapter on sleep disorders, which I think is one of the best chapters I've ever seen on sleep in older adults. And that has like 5 different authors who that is their specialty. So that's really awesome. And then Chapter 17 is on dysphagia and malnutrition. And Chapter 18 is pressure ulcers and skin care. Then when we get to Unit 6, as you can see on the next slide, we have a section on leadership and responsibility. So there is a chapter on the gerontological nurse as manager and leader within the interprofessional team. And that has quite a few different authors with different backgrounds on that chapter too. And then Chapter 20, we've combined ethical legal principles and issues into that chapter and kind of taken out some of the overlap that was in previous chapters. And then the next unit is information and healthcare technologies, and I'm not sure that actually is on your slide, but there is a chapter on technology and care of older adults. So how do older adults use technology? How do we help them use technology, and how do we use technology in caring for them? And then lastly, we have gerontological care issues, and we have a chapter on culture and spirituality with some awesome tables of how different religions view death, dying, their practices, and those types of things. We have a great chapter on sexuality by Don Kotz, and Don is a good friend of mine from the Association of Rehab Nurses, and he's truly an expert in gerosexuality. And he kind of weaves the story of his own parents with pictures of them and how they met and their relationship and all the years they were married into that chapter, which is really kind of adds a personal flavor to it. Then we also have updated the content on prevention and treatment of elder abuse. And I brought in a nurse who has forensic nursing experience and credentialing, and she really added a lot to looking at elder abuse and giving us great strategies for prevention and detection. So that was really exciting. And then we have a chapter on pain management and alternative health modalities, so the CAM practices, and a new chapter on disaster preparedness. And this is still all under gerontological care issues. And we added this chapter on disaster preparedness. It's by Elaine Miller, who was the prior editor of Rehab Nursing Journal before I came on. And they talk about how you triage strategies in disasters and a lot of pictures and things like that. So that's a really exciting new chapter in this edition. And then we have the end-of-life care, which is also one of the best chapters on end-of-life care that I've ever read in any book. And that's by a social worker and clinical nurse specialist who both work in palliative and hospice care. And then lastly, we've combined several chapters in the last chapter in the book and brought in some different authors. And that last chapter is Care Transition System Models and Health Policy and Aging. So that combines a lot of content from prior editions into one really good, meaty chapter there. So that's kind of an overview of the book, and I think it has a lot of great information in it. So what are some of our key features? Well, every chapter has learning objectives, and the test bank questions are tied to those as well. There's a list of key terms which are bolded in the text, and then there's a great glossary. So if students don't know what a term is, they can just look at the back of the book and there's a glossary of all those terms, and it's very comprehensive. We have lots of tables and boxes that highlight information. There's a lot of original drawings and photographs, so it's not just all like stock photos. And in every chapter there are case studies with questions for students. One of the new features that I'm so excited about is the clinical tips feature. And in other books you might see this as being like key concepts or something like this, but I pulled out these clinical tips from each chapter to show students things that I, as a Gero nurse practitioner or CNS, would think are very important for them to know. So these are really clinical practice hints of, hey, remember this, or just notice that these two things might go together, or here's what this sign or symptom could mean. So I'm very excited about that because I think it makes the book a lot more practical. And then, of course, we have boxes that have research highlights and evidence-based practice. We kept what used to be critical thinking exercises and are now clinical reasoning exercises. We still have personal reflection exercises right in the book, and there's lists of resources, and then, of course, references, including lots of websites for students to go to if they wish. Then if we look at the next slide here, you can see what the instructor resources are. So there are PowerPoint slides that go with each chapter, and these really kind of give you a shell of the chapter, but you can go in and add whatever you want. You can add pictures, you can add your own stories, but at least it gives you like a template and the main points in the chapter. And at the beginning of the PowerPoints, it'll review the learning objectives, so it goes along very well with the book. There are sample syllabi, so things that I have used as an instructor in my classes. I put all those suggestions into an instructor manual, and also test bank questions to get you started. If you are in charge of doing a course, say you're new to teaching a Gero course, or you've been charged with threading Gero throughout your curriculum, you can use, hopefully we have taken most of the work out of developing this yourself, and we've used my 30 years of experience and put them all at your fingertips for you. So hopefully that will be an excellent resources from Jones and Bartlett for you. And for student materials, there's an interactive glossary, there's fun things for them to do online, like flashcards and puzzles, and more case studies, and actually pulling things from the book. If a student likes to do digital or online learning better, then they can find these at their fingertips too on the Jones and Bartlett website. So why do students say that they like this text? Students think it's user-friendly, and I actually poll my students, have polled them in the past to say, now how could we make this book better? What they like is that it's comprehensive and they can keep it as a resource. And actually students like that it's competency-based because they're used to competencies, and they like the colors, the colors on it, and feel like it kind of speaks to them. So it's student-friendly. And then if we look at the next slide on why instructors like this text, the number one reason is that it's based on the competencies from AACN and the Hartford Foundation. They also like that it's colorful and that it's comprehensive, and they love the instructor materials and that content is evidence-based. And you can see a couple quotes there for those of you who are on the WebEx. I'll read them for those who are just on the phone, but it says, I really like that there's complete chapters on communication and teaching. Many geriatric books do not address the topics to that degree. I also like the way the book is separated by topic areas. And another instructor said, one of my favorite things about Mauk's book is how it is organized around the competencies. It's a very comprehensive book. So what's new to this edition? Communication and teaching, as I mentioned, is really a totally revised chapter. And we brought in a master teacher to write that so that it would have a lot more meat to that chapter. The disaster preparedness chapter, I said, is totally new, but I think in light of many things that have happened in our country, like Katrina, and in the world, many other disasters, having a chapter like that, you know, what do you do with all the people who are in nursing homes if there is a disaster nearby, a tornado, hurricane, all things like that. So this chapter gives some really current information about that. And then the last chapter on care transitions, models, and health policy. We put in some more health policy to make it a little bit more understandable and explain things about Medicare, Medicaid, and those types of things. And then also look at models that work for geriatrics, whether it's like heart-healthy models or models from different countries, and also brought in some rehab nurses to look at care transitions. So we know that that's very important to have safe transitions from setting to setting, as our older people move very frequently to different settings. And so there's a lot of content on that. As I mentioned before, there's updated content on elder abuse, and also we've added some additional information on pain management and those complementary and alternative medicine therapies. And the whole book really does emphasize healthy aging and management of those geriatric syndromes, which is really important. But also in this edition, I mentioned that we have quite a few new authors to refresh the content, and the content is streamlined. So prior, in the third edition, we really had quite a few hundred pages that had been moved to e-chapters because we had so much content. So for this edition, we kept all of our very strong chapters, and we really streamlined some of that content so there was not duplication and just very essential information but still being comprehensive. And then we added the clinical tips feature. So if we end now on tips for teaching, just as an instructor, I would say don't be afraid to be creative, because we all know that students, you know, the literature really shows that students still kind of have a negative attitude towards gerontological nursing, and they may like older people okay, but most of them, it's not their goal to, oh, I'm going to go work, you know, in the nursing home, or I want to work in gero nursing. There's still a little bit of a stigma that, oh, you only work there if you know, can't get a job somewhere else, or you get burnt out, then you go into gero care. But I think that trend is starting to change, and certainly we want to structure our activities in our classrooms or online that promote a positive view of aging and of older adults. And certainly our older adults deserve the best care that we can give them. So I would encourage you that our teachers, you know, consider fun things like service learning projects or health fairs, teaching at senior centers. You want to give your students a positive experience with older adults. There's nothing that turns them off faster than having to do a clinical early in their career and having a negative experience. So we want them to have positive experience in caring for older adults. We want them to like their gerontology class. And remember that you can use this book for a standalone course, or you can thread it through your curriculum. I would say it's used in many different ways. Even though it is written as a BSN level text, some programs use it in their master's program and for certain courses. But it definitely is comprehensive related to gerontology and gero nursing. So I really would encourage you to take a closer look at it. I'm going to turn it over to Liam in a minute to talk about the Navigate to Advantage access. But I want to emphasize, too, that you can schedule a call with me personally or even Skype. Have a Skype meeting or a Zoom meeting with me and your class. And I have had instructors do that where they set up a time the first day of classes. They're going through orientation and they're using my book, and they'll put me up on the screen and let their students ask questions, and I'll tell them, like I did for you, a little bit about the text and why it's important. And if you want to add that to your class, I am happy to do that for anybody who requests that. So now I'm going to turn it over to Liam to talk more about the Navigate to Advantage access, and then after that we'll have some questions. Liam?
Thank you, Chris. I appreciate that. I'm going to be talking about Navigate to, so my screen's going to go dark for a moment while I pull up my course. But I do want to let you know that Navigate to does come with every new textbook. And then we also have a digital discount to just access to Navigate to by itself for your students. So they can buy it within the textbook, or they can buy digitally by itself. You can also request a trial course or a demo through your account manager. So if you're interested in getting more information, please reach out to us. What I'm showing you now is just a very quick preview, but we can do more in-depth training and demos for you individually as well. Also, just before we get into Navigate to, I just want to mention it does integrate into Blackboard and to Canvas. And you can also request instructor resources for other LMSs like Moodle or D2L. And you can reach out to your account manager for more information on that as well. But this is the main page of Navigate to. Today I'm actually showing the 3rd edition of the book since the 4th edition is not out yet. But this is what it's going to look like when you get your course and when you go into it. So we have 2 ways that students can actually get into Navigate to. One is an instructor-led course where you as the instructor have the ability to come in, customize it, get all the reports within Navigate to. And then we also have what is called open enrollment. And that is for those students who purchase the textbook but don't have an instructor-led course. So it's a generic course. It's going to look just like this. They're going to have access to the content that we pre-built into it. So they'll be able to access things like the e-book, which I'll show you in a moment, as well as some practice activities and case studies that we're going to build into the course. But once you get your course, and we're looking at the instructor view now, it's very similar to what the students are going to see. You're going to start here on the Lessons tab. And then if we come down here and we click on the chapter, you're going to see the student resources that we've built into the course. So everything here that you see is built into the course by default, except for this chapter quiz. It's something that I added in myself, and as the instructor, you can create your own chapter quizzes, or you can do multi-chapter quizzes or exams within the course. But every chapter, when you select it, we'll open it up and display all the content that we've added. So this is where you're going to find things like the learning objectives. We add into our courses slides, lecture outlines, and different items within here for students to access. But what I want to focus here today is the e-book. So if we select the e-book, it's going to pull up, and the e-book is going to look just like the textbook once this loads up. And there's 2 ways to read the e-book. One is on the computer, like I'm showing you right now, and then we also have an app that is available as well. It's called Navigate e-Reader. It is a free app that's available through the Apple App Store for iPhones, iPads, and the Google Play Store for Android phones and tablets. And the good thing about the app is students can also download the book. So if they want to take it offline with their mobile device, they do have the capability of doing that. But as you can see here, the e-book looks just like the textbook. You can even turn the page like the textbook. You do have the ability to come over here. You can change the page layout. You can zoom in, so it makes it much easier to read. Students and instructors will have the capability of coming over here and adding in notes into the e-book. The lead instructor in the course will have the capability of sharing their notes and highlights within the e-book if they choose to, where students can only make notes for themselves. And these notes and highlights, once you save it, will also appear in the e-book. So in the app version of the e-book, they have the capability of downloading these notes and highlights, and vice versa. Any notes and highlights they make on the app can show up on the computer version as well. And then down here, we do have table of contents. They can access any section of the book right from here. We do have a built-in glossary, so you'll be able to access all the glossary terms right here. And then any of these dotted underlined terms within the book, students can select, and it'll give them that definition as well. So it makes it very easy for them to go in and pull up all the glossary terms within the book. We've also added in some additional resources into the book. So in here, we're going to add e-book quizzes. So these are end-of-chapter quizzes within the e-book that are available for students to take. These are here by default right out of the box. They're going to grade automatically. So when students come through and finish taking the e-book quizzes, it will report that grade into the grade book. They'll see their score immediately, but in the grade book, that's where they can go in and they can review the e-book quiz to see what they got right and what they got wrong. And then also under resources, under media, this is where we're going to add in some additional items. So we have some animations and other items that we built into the e-book that are not available in the print textbook. And then finally over here we have a search feature. So you can come over here, search for a keyword or term. It's going to search the entire book. I'll tell you how many times that word or term is used with a little preview on each page. And if you select the preview, it's going to bring you to that page and it's going to highlight that word for you. So those are the student type of resources that we've added in. So for the instructor type of resources we've added in, we've created this teaching tool. So only teachers will have access to this tab here. And then when you get the course, we'll have course material, which will be available. So this is where you're going to find things like the instructor manual that we added into the course, which is very thorough and has been updated for the 4th edition. You will also be able to find, if we've had discussion questions into the course, you'll be able to find them here, along with the lecture outlines and slides, which students have access to as well. And then if we come back to the course, you will have the capability of uploading your own content. So maybe you've taken some of the slides that we gave you, and you have gone in and you download them, made your own edits, add in your own content into it. You can very easily upload your own content back into the course. So you can actually just drag and drop content from your computer right over one of these chapters. And just like here, you can see it uploaded. I have a sample PDF and Word document, but if you have PowerPoint slides, anything, you can come in here and just drag and drop it. You also have the capability, and you can see here when I put my mouse over each chapter, there's add an activity or resource. You can add in activities, which are gradable items, and I'll get to that in a moment. But down here we have resources. So this is where you can add in content, non-gradable items. So you can upload a file this way if you didn't want to drag and drop it. You can link out to different websites through a URL. And with this page feature, you do have the ability to embed YouTube videos directly within the course, so students can watch the videos right within the course and not have to go to YouTube. And then over here we have activities. So you have the capability of, creating assignments. So if you want your students to write a report or upload a file that you want to grade, you have the capability of doing that through assignment. And you also have the capability of setting up graded discussion forums or ungraded discussion forums that your students can go through as well. And then down here we have Navigate to Assessment. So this is where you're going to come in with the 4th edition, and you'll be able to create your assessments. So from here, you have the capability of setting up all the settings. So you can create a Chapter 4 quiz, or if you want to create a midterm or final, or even a practice activity, you can do that right through Navigate to Assessment. And just like other learning management systems, you have the capability of choosing when it's going to open, when it's going to close. You can give a time limit for students, and you also have the capability of giving students additional time. So any student who may need time and a half on the test, there is an option to do that within the course. So once you go through all the settings and you set it up the way you want, then you come down here, go to Save and Display, and we're going to be able to add questions, into this course. So this is just a sample course, so I don't have all the chapters, but you would see all the chapters here listed with all the questions that are available, and then when you select a chapter, and once again it's a sample, so I just have the first 3 chapters, you can come over here, you can preview questions, so you can see the full question. If you need to, you can edit any of the questions from here with the edit option, and then you can come over here and select the questions you want and add them to your assessment, and you can create your own tests and exams within the course. So that is just, a quick preview, of Navigate to. Once again, if you'd like a longer or deeper demo or training session, please reach out to your account manager and we can get one set up for you. So at this time, I am going to pass it back over to Jen.
Excellent. Thanks, Liam. That was a great presentation, and I also want to thank Chris for your in-depth overview about care of the elder adult as well as the 4th edition of your textbook. So, Chris, a couple questions did come up from one of the faculty on the line. She was asking, does the chapter on dementia also cover dementia from the perspective of those adults that might have a pre-existing mental illness?
In that chapter, not specifically. There's information about how to deal with behaviors, and in other parts of the book, some of the mental health issues are addressed. So you can kind of use those, I guess, in tandem. That chapter focuses more probably more on practical ways to deal with typical behaviors in dementia and not as much with coexisting mental illness. I hope that answered your question.
We do have one additional question. We had a faculty member asking if ageism or stereotyping was included in the text.
Yes, ageism is discussed in the foundational unit, and yeah, and Dr. Haber in his chapter talks a lot about that as well.
Excellent. Thank you. It doesn't look like we have any additional questions from our participants today. I do want to thank everyone for attending. I also want to give special thanks to Chris for spending some time to talk about the 4th edition of our textbook, as well as some best practices for how to incorporate this content into your course. Take care and have a good rest of the week.